Hi everybody. Someone reached out and asked me to do a talk on teething. And teething gets blamed for way too many things. Teething is just that, teething. Maybe some discomfort, definitely causes drooling, but it doesn't cause any other symptoms. So teething does not cause a real fever. In medicine, in pediatrics, we consider a real fever 100.4 or higher. We do not add a degree. I think I'll say this in every time I talk about fever. 100.4 or higher, if your child has that kind of temperature, it's not from teething. Look at a real illness. If your child has real diarrhea, and I don't mean one liquidy stool, I mean multiple liquidy stools, that is also not from teething. It does not cause diaper rash. Teething does not cause diaper rash. What? Yes, old wives' tale. It does not cause diaper rash. It also does not cause your child to get sick more often. This is one I just recently heard, and I've been a pediatrician for a couple decades. So listen, teething is just the eruption of teeth. It can cause discomfort. The earliest I've seen teeth erupt is around 4 months. More commonly, 6 to 9 months. The late bloomers, 12, 15 months. I've referred kids at 18 months when they haven't erupted teeth, and guess what? The dentist sent them right back and said, they're coming, just be patient. Typically, our babies get teeth the first middle 4, and then they grow out from there. I have seen crazy things where babies get some of the lateral teeth first because that just happens to be what happens. What should we do about teething? I really enjoy that we do not use teething gels, no teething tabs, no medicines, occasionally a Tylenol here and there. Let us not dose Tylenol or Motrin every 4 to 6 hours because you think your baby's in pain for months at a time. That's not appropriate treatment. I love taking little baby washcloths, the very fine ones, wet them, put them in the freezer, let them get nice and cold, and then let your baby chew on those. That's not gonna be dangerous to them. They also love chewing on their little sippy cups. That's okay too. I don't like them chewing on the little gel-filled things because they bite on it and that stuff explodes in their mouth. But teething toys that don't have liquid-filled stuff in it, they're okay. I don't love those tight amber necklaces. They're dangerous. There's no study that shows amber necklaces are gonna decrease teething. If you think that that's helpful, it's a choking hazard, like literally a choking hazard. We do not want children to pull and then choke on themselves. And they can suck on their hands and they can suck on their rattles. Those are all reasonable things. Please listen to me, I already said this. We need to avoid gels that you put on your teeth, like benzocaine, lidocaine. We do not want that to happen. There has been information that can cause a specific type of anemia that is very dangerous to children. We do not want to put alcohol on our babies' teeth and gums. That's an old wives' tale too. Please do not put rubbing alcohol on your children's gums. Homeopathic type of things. We really don't want things like belladonna and coffee. What is it called? Crudo? We don't want to put that on there. Those are not safe, not effective. Belladonna has actually got a really unsafe side effect to it. So please don't use that. And anything that they could choke on. In general, normal teething toys that don't have liquid, putting a washcloth, put it in the freezer, let them chew on that. Occasional dose of acetaminophen, and teething will pass. It is a frustrating phase. There is a lot of drool, but that's all there is to it.